Hi everyone, Dr. Remy from Posture Size and Pain Free and Fit. Today is part 2 of our series on basic essential movement patterns for Facet Syndrome of both the neck and the lower back. Today we're going to be discussing how to twist or rotate without irritating your Facet Syndrome. Hope you enjoy. So Facet syndromes in the neck, cervical spine, and lower back lumbar spine are often aggravated by two particular motions, and that is extension or leaning backwards, which we covered in a previous video, and rotation or twisting. And the reason this is because rotation puts a large stress, tensile stress, on the facet capsule, which can pull and tug. If it's already irritated, that capsulitis is going to be more aggravated. It also pulls on many of the adjoining soft tissues, ligaments, muscle, and tendon fibers that are many times involved and inflamed in Facet syndrome. So learning how to stabilize both the neck joints and the lower back facet joints helps to relieve a lot of the typical pain caused by turning with Facet syndrome that causes pain. And we're going to go over two basic motions here, one with the neck and one with the lower back, and we're going to combine them for you to practice how to twist without aggravating your Facet syndromes. Let's start by learning first about the neck. When we twist or look to one side, if the curve in the neck is accentuated by having forward head posture, which is a common finding with a lot of people with Facet syndrome, then those facet joints are going to be more likely to be pinched and irritated. Conversely, if we hold our face towards the back of our head, that's called head retraction, that takes the normal curve in my neck and flattens it out a little bit. It opens the back of the facet joint so the synovium doesn't get trapped inside, takes a lot of compression pressure out of that facet joint. So as we hold the face back, we're going to continue pulling the face back as we turn. And that's a basic motor pattern to decrease the stress and extension. A lot of times people with Facet syndrome, if they look quickly, they'll feel a pinch. If they simply pull the face back and turn slower with the face accentuating towards the back of the head, they'll realize they have a greater range of motion with no pain at all or reduced pain. For the lower back, as we turn, we don't want the lower back to do a lot of rotation. The way our spine is built is the mid-back is more designed for rotation and not the lower back. And with Facet syndrome, many times because of tightness in the hips and the mid-back, we twist too much from the lower back, which takes those facet joints and imbricates them or overstresses some of the soft tissues. So the way we're going to practice the lower back motion is to take one finger and put it on your belly button and the other finger on your pubic bone. And practice turning, number one, with your hips. You see I'm moving my whole pelvis. And as I turn with my hips, I want my pubic belly button and pubic bone to stay aligned with each other. I don't want to let my belly button turn more than my pubic bone. That would indicate a motion coming from the lower back. But if they turn together as a unit as you swing your hips, that's going to make sure that the lumbar spine or the lower back is not turning at all, but the motion is coming from your hips and lower extremity. The next motion we want to practice is mid-back rotation, which keep the same points and twist your shoulders. Again, you don't want your belly button to move, just your shoulders. That's motion now coming from the mid-back or thoracic spine, and it decreases any bit of motion coming from your lower back. Putting them together, we can turn, let's say, to the right side by turning our hips to one side. When the hips run out of motion, keep the belly button and pubic bone aligned and make the rest of the motion occur from your shoulders. In this way, we're allowing the lumbar spine to be held stable without any rotation and emphasizing that motion from the hip and the thoracic spine or mid-back. You can practice that side to side. You can do that with and without resistance. Over time, combining that with the neck is going to help you rotate and learn a new motor pattern that's going to decrease the stress on your Facet syndromes. We have plenty of exercises that support that on this channel. If you like this video and would like to learn more exercises for Facet syndrome pain, please subscribe. If you'd like to help me share this vital information with others, give me a thumbs up below. Help me share it. Any questions or comments, feel free to write in. I'll do my best to get back to you, maybe even make a video on your question. If you're looking for a unique exercise program that addresses your unique customized problems and correcting the issues that you have biomechanically that are feeding your Facet syndrome, like muscle imbalances, like poor stabilization muscles, like poor posture and alignment, feel free to go to our painfreeandfit.com website. We have a fast-track healing exercise program for Facet syndrome there. It takes you step by step and teaches you how to do a body analysis on your mechanics, both of your spine and whole body that may be affecting your facet joints, what particular stretches are good for your unique condition, strengthening and conditioning exercises that help increase your core and spinal stability to help you prevent your Facet syndrome pain. If you'd like to get a one-on-one consultation with me, feel free to also go to the painfreeandfit.com website. We can get on board with a video conferencing call between us. I can analyze your posture, your mechanics through the camera. You can find the exercises that I teach you. We can hone them down, make sure they're right for you, and help make sure that you're doing your exercises the correct way. I hope this series on Facet syndrome, basic essential mobilization and movement pattern exercises, both extension and rotation, helps you with your chronic neck and lower back pain.